Hi, Dr. Kinderlehrer, Christina Bauer with the Texas Lyme Alliance. How are you on this cold winter day?
I'm good. It's a nice day.
Good. Yeah, you're used to it in Colorado, but us Texans are freezing. I wanted to meet with you again today about your new book and speak to you about desperately needed discussion on stomach health and Lyme-related eating disorders. So welcome today, and thanks for joining me.
You are quite welcome. I'm really glad to be here.
Great. Thanks so much. Little about you. Dr. Kinderlehrer is a Lyme Literate internist in Colorado, Denver. After completing a residency in internal medicine in 1979, he opened one of the first practices in the U.S. in what was then called holistic medicine. After becoming an expert in nutrition and environmental illness, he became ill himself with Lyme disease complex, otherwise known as persistent or chronic Lyme. His long road to recovery has given him insights into what patients are going through. His background in internal medicine trained him to understand the complexities of his multisystemic illness. His knowledge of environmental illness has enabled him to evaluate immune dysregulation, and his study of energetic medicine, spiritual alignment, and healing from trauma has yielded insights into how to help patients shift their belief systems into being well. Recovery from Lyme Disease is his new book that we're going to be meeting today for the second time to discuss. And by far, it is the most thorough book available on Lyme disease complex. It will provide patients with information that will guide them on their healing journeys, as well as supplying doctors instruction on appropriate diagnostic and treatment approaches. Dr. Kinderlehrer enjoys teaching his patients, hence his name in German means teacher, the medical community, and we're honored to host him again for our fourth interview. His book is going to be available on Amazon in March. Please don't forget to leave a review. How do you identify a Lyme-related eating disorder in your patient group?
The most common issue that I've seen is food addictions. And
oh, wow. I wouldn't have thought that. Okay.
that would be the most common. So
wow. Emotional eating, right?
There's an amazing book that was written probably 3 decades ago by Theron Randolph, who's the father of environmental medicine, and Ralph Moss, who's a science author. And it's called An Alternative Approach to Allergies. And it's been republished. That is, it's available now. And I highly recommend it. They do an amazing job describing the allergy addiction syndrome. The book is An Alternative Approach to Allergies. Here's a common scenario. Little Johnny, as an infant, has a whole lot of colic, and then they decide to give him a milk-free formula, and perhaps he does better. But then when he starts eating, there's dairy back in the diet, and he's frequently congested. Maybe one of these kids who has the allergic salute, which is that, just always, always sniffling.
Runny nose.
Kind of and then he gets lots of ear infections, right? And with the ear infections, he gets lots of antibiotics. With lots of antibiotics, he gets a lot of candida or yeast overgrowth. With lots of candida and yeast overgrowth, he becomes sensitized to that. Now, the foods that he's sensitive to are often the foods that he craves, that there is actually a stimulation withdrawal cycle. We as adults can relate to that in terms of caffeine. There's a stimulation, then there's a withdrawal. And the faster a food gets in the body, the more likely it will do that. I mean, heroin is the fastest, and that's what is the most addictive. But then you go down the line, sugar and alcohol and caffeine are the most addictive foods we eat. But now anytime this Johnny, who is now not only sensitive to dairy and is chronically congested, is now sensitive to yeast. That means he's going to crave sugar because sugar feeds the yeast in his body. What happens is at this point, the kid wants sugar all the time.
Yes.
And, he's always looking for sweets, sneaking sweets, lots of carbs, lots of bread. Very interesting. I had a kid in here, and he was, I'm going to guess he's about 8 years old. And, he had Lyme, but he had what he probably has, a PAN syndrome, a lot of oppositional anger, irritable, acting out behavior, and sometimes beating up his brother. So the parents were trying to be very conscious. They had read books on Lyme, and they had taken him off of wheat and off of dairy and off of corn and off of sugar. And I said, well, does he crave anything? They said, well, he could eat a whole jar of pickles or a whole jar of olives. And I said, boom, that's Candida. Those are fermented foods. And I said, you're going to need to take him off those foods and stay really low yeast and so on, and expect that he's going to be really in a bad mood for the next week or so, because he's going to withdraw from that. And that's exactly what happened. And then the kid just totally evened out and his mood was good until things went south again. And it was actually my fault, because I said, I think he might do okay with corn. And when he came back and things had gone south again, I said, well, did anything change in his diet? And they said, well, we let him have corn chips. And the kid immediately said, don't take away my corn chips. And he said, bingo, it's the corn. It's really, so what I see, and I see this in adults all the time, particularly with sugar and yeast. Those are the ones that, people have really, really severe sugar cravings. And the scenario is, if I can get them to stop, and it has to be cold turkey. This is not one of those things where you can taper down. So if they go cold turkey, then for the next 2 weeks, as an adult, it's usually 2 weeks. As a kid, it's usually a week or less. For 2 weeks, they're dreaming of shooting someone for a donut. I mean, their cravings are strong. They're really irritable. They're angry. They have headaches. The same thing you'd expect from caffeine withdrawal. But it can last a couple weeks. I've had people go to bed with these withdrawal symptoms. For 2 weeks or so, they say, whoa, I feel so much better. My body's relaxed. I don't have that nagging headache, and my bowels are moving better, and this and that. Then what happens is, and they're not craving anymore. It's not happening. Then they go to some sort of social affair, and there's a plate of cookies, and they say, well, I could just have a bite of cookie. And they have a bite, and they say, oh my God, this is so sweet. I can't believe I used to eat this.
I know, it's terribly different.
But they take a second bite. And at that point, they're gone. You can't have just a little bit. They're totally off the wagon. And these are the people who often are binging. So that's the most common food disorder I see. I see people binging, and usually the issue is sugar and yeast. That's the most common. Now, it's very interesting. I have just last week submitted a paper to a medical journal, a case history on a young woman. She came to me, her parents brought her to me when she was 16 years old, and she was diagnosed with anorexia nervosa. Now, there's anorexia, which just means loss of appetite and decreased food intake, but that can happen to any of us when we get sick. And then there's anorexia nervosa, when there's distorted body image and needing to reduce weight to limits that really are quite unhealthy, and all sorts of behaviors that go with that. So she basically stopped eating and believed that she was overweight, and she was also doing some purging, and she was in and out of eating disorder units. And this was so severe that the doctor said, we don't know what else to do for her. She was on medication. She was getting food through a nasogastric tube because she wouldn't eat. And they said, well, maybe if she gets, she just continues to go downhill, she'll almost die and then maybe have a near-death experience and want to start eating. That was the most they could offer. Obviously that freaked out her mother.
Pretty harsh.
Oh my God, it's terrible. So her mother is a nurse, and she's pretty savvy, and they had lived in upstate New York for most of her childhood, and had her tested for Lyme disease, and it was positive, and she came to see me. Well, what was really interesting was she had what you and I call Bartonella stria, right? She had what looked like stretch marks, and she thought this was a sign of being overweight. But they weren't stretch marks, they were Bartonella stria.
Oh, poor thing.
Yeah, so I wrote her up. I just submitted that to a medical journal. We'll see what happens. But she tested positive to Lyme. She tested positive to Babesia, to mycoplasma, very high levels to mycoplasma. And while she did not test positive to Bartonella, there's no question in my mind she had Bartonella. In fact, when we gave her something to treat the Bartonella, she started to get worse again in the form of a Herxheimer reaction, which suggests to me that that was the biggest culprit. But we had her on antibiotics for a few months. We had her on antibiotics for a whole year. But she went into total remission and has stayed in remission for 4 years now. She's good. It turns out that there are quite a few infections that have been associated with anorexia nervosa. So, and the PAN syndrome is often associated with anorexia syndromes. It's actually one of the criteria, major criteria for PANS. So the most common issues I see are the food sensitivities, which then throw off the whole diet in the form of cravings and so on, and can generate all sorts of systemic inflammatory symptoms, and particularly the gastrointestinal symptoms, particularly Candida being the worst. The most common food sensitivities I see in my patient population are dairy, eggs, gluten, those three, and then sugar and yeast would come next. When I take a history, I don't start with when did you get sick, which is usually a pretty vague question or answer, when someone with Lyme, right? Because things fluctuate so much. I start with tell me about your childhood. And so I want to know, what their childhood was like, but I asked them, okay, did you have frequent stuffy runny noses, ear infections, strep throats, asthma, hay fever, and then I go through, did you have lots of headaches, belly aches, diarrhea? Usually, often people have these symptoms, but they don't offer them because they didn't think they were significant. But if someone had, oh yeah, I got ear infections all the time, and I was congested a lot, I got recurrent sinusitis, right then I'm making a little note to myself, food issues. And often, it's so sad because often, in their 30s, they find out, oh my God, this chronic sinus infection went away when I went off dairy and gluten. And it's too bad that their doctors couldn't have told them that when they were a kid, right? I mean, they've suffered for a few decades because doctors just aren't tuned into this. This is where my background in environmental medicine has helped a lot. Before I was a Lyme doc, I did a lot of environmental medicine. I even taught at the environmental medicine conferences, and I took thousands of people through elimination challenge diets. Back then, it was a lot easier to do an elimination challenge diet, which is still the best way to diagnose a food sensitivity. There are blood tests available, and it's reasonable to use them, but they're not 100% accurate. They're false positives and false negatives. I do go through how to do an elimination challenge diet in the book. But in the old days, there were only half a dozen foods that most people would be sensitive to. And then there's another half dozen that would mop up the other 5 to 10%. And rarely would someone be allergic to anything other than those dozen foods. Nowadays, though, people are allergic to rice and to lamb and to asparagus or avocados, things no one was allergic to back a generation or 2 generations ago. We never saw that. It was very easy to put someone on a diet of lamb and fish and rice and quinoa and greens and sweet potatoes, and boom, that's an elimination diet. It would work for everybody back then. Not anymore.
Do you think that the rise in the use of pesticides, farm-raised fish, hormones and antibiotics have destroyed our guts so much from the food and flesh that we eat with containing those environmental toxins is causing the difference between what you used to be able to prescribe for people to heal their guts from what you no longer seeing some of those things working any longer? Do you think it has to do with that?
I think there are multiple factors.
Okay.
And while we're talking about the increase in food sensitivities and sensitivities in general, we're seeing more people with multiple chemical sensitivities. We're now seeing people with electromagnetic field sensitivities, who are really the canaries in this coal mine, because that's going to get worse and worse, particularly with the 5G networks.
Yeah.
We're seeing a lot more sensitivity syndromes, but we're seeing a lot of immune problems. There are a bunch of epidemics besides COVID, of course. Besides Lyme and co-infections, look at autism, look at obesity, look at type 2 diabetes, look at certain types of cancers. And when I see all of this, I really think we're talking about something that's happening particularly over the past 100 years. So first of all, there are major dietary changes, such as the amount of sugar in our diets has gone way over the top, but also, we refined grains, so we're taking away a lot of the vitamins and minerals, and actually we've depleted the soil of minerals. So there's been a significant decrease in nutritional density of our diets. But at the same time, as you're alluding to, Christina, we've added tons of toxins, in the form of direct ingredients into our food supply, but the way they're grown, and the pesticides and herbicides and all the other pollutants in the air and water that get into our food supply. And this compounds from generation to generation. There are other issues that compound from generation to generation. So one of them is stress factors. Over 100 years ago, most of us lived in communities and extended families. And there was sure lots of reasons to be stressed, but we had community, we had belonging. And that had a significant impact in our ability to just deal with the everyday issues that we have to deal with, even though they tended to be different then than they are now. Then, we went from these community and extended families to nuclear families, single parent families, no parent, homeless families. I mean, it's really been a disaster. And it has a major impact on our sense of safety and belonging that affects our metabolism, affects our immune systems. And what has been demonstrated with all these different factors that I just described, from changes in nutrients to the exposure to toxins to, and then not just toxins in our food supply, but what's happening in the air we breathe and so on. And then the stress factors, it causes epigenetic changes. Epigenetics refers to changes of proteins that sit on top of our DNA that impact how that DNA is expressed. So in general, DNA is pretty stable over millennia. It takes a long time for DNA to evolve. But these proteins can turn on and off the DNA, and that can change from one generation to the next. So it turns out that all these factors I mentioned, they can impact epigenetics and then immediately be tossed down to the next generation, which compounds it with the next generation. As far as we know, these antibiotics can clearly have an impact on our microbiome, and then there's a whole host of potential issues associated with disruption of the microbiome. We don't have evidence that the antibiotics have direct immunosuppressive effects. Some of them have some anti-inflammatory effects, but that doesn't mean they suppress the immune system. And you're right that there's a whole lot more antibiotics in our food supply than what's being prescribed through pharmacies, a whole lot more.
Yeah.
So that is another issue. But I'll point out that even a parent having some trauma and PTSD, that can be inherited. That can be passed on epigenetically, so that children can be born with PTSD, with anxiety syndromes and so on. The obesity can be inherited from one generation to the next on basis of epigenetics. You know, so again, when you look at all these different factors and the fact that children, babies, they're not born with a clean slate.
Right.
You know, there's this accumulation of epigenetic stresses. And now we're seeing what? We're seeing lots of immune disruption with all of those epidemics that I just mentioned. So a whole lot of autoimmune reactions. And this is actually a focus of the very last chapter of my book, where, you know, we're just seeing more and more immune dysregulation. Doctors like myself who see people who've fallen through the cracks all agree that people are sicker. They're sicker than they used to be. They're sicker and sicker. They're more and more challenging to try to find the key to unlock what's happening with them. And doesn't speak well for our future.
No, and I wanted to also add, I made a quick note that when we lose our sense of community and sense of belongingness, some of the reason has to do with faces and phones. We're not having direct conversations anymore with people. We're not phone calling like old school. We're texting or we're on social media. But I think this onslaught of epidemics is a cycle of our own behavior, and some of it's learned from what we see, and some of it's such a disconnect that we have to really take a closer look at our own behavior. And I do it myself. I really pay attention to my screen time. My iPhone so clearly tells me every day how much I'm using. So that's part of how we're you know, and the foods that we eat and the things we put on our skin, etc. Those all have a direct impact on our ability to detox and have attachment with people that love us and we love, and to have a full healing ecosystem that we're creating for ourselves. And I really think patients need to re-identify what that means. How do you treat GI problems? Real quickly, some of the things I mentioned were, what binders do you use? GI detox you mentioned during one of our videos, which I started and have excellent luck with that one. Thank you for that recommendation.
Oh, sure. So, okay, I'm going to give a quick overview of the kinds of gastrointestinal issues that I'm used to seeing. When I see patients and with gastrointestinal issues, I'm very specific in my questions. Do you have abdominal pain? Where is it? How is it related to when you eat or don't eat? And does it travel, etc.? Do you have bloating? Do you have flatulence? Do you have belching? Or borborygmi, which is just a lot of gurgling in the gut? Do you have diarrhea or constipation, or both? I mean, this is all important information to try to sort out what may be underlying. And then the issues that we look at are, first and foremost, are the food sensitivities. I do see a lot of people with candida or yeast issues, but I also see a lot of people who have loose stools, and often even see some food coming through in their bowel movements. And they often have pancreatic insufficiency. They aren't making enough enzymes. And you can get enzymes over the counter or by prescription, take them at the end of the meal. And often that makes a big difference. Something I see with some frequency that is not appreciated at all by mainstream docs is low hydrochloric acid. Low hydrochloric acid classically causes constipation, bloating, gas, and belching, and a condition called early satiety, which is just a fancy way of saying food seems to want to sit in my stomach. It takes a while for it to go down. Even worse with meat. And by and large, someone going into the gastroenterologist with GI complaints, they look up you, they look down you, and they say, well, you don't have an ulcer, you don't have a tumor, so I'm going to put you on a protein pump inhibitor, which is a terrible idea. We can get into that later maybe. But often people have a handful of different issues. Most of my patients with GI issues do have a handful of different issues. So they might have low stomach acid, and we have to slowly help them replace that with betaine hydrochloride supplements. And that in itself is tricky, because if they haven't had any stomach acid in a long time and you give them a little bit of acid, they'll suddenly have all sorts of indigestion and heartburn because their stomach lining is not acclimated to acid. We have to go really slow, like with a little bit of vinegar, that kind of thing, to slowly acclimate their stomach lining. But that can really help their digestion. But remember, low stomach acid is a risk factor for low mineral absorption, and that means osteoporosis, among other things. It means that you're going to have more difficulty digesting meat, and you might be low on amino acids. And it's important to kill bugs, microbes, before they get into your intestine. So you're more prone to things like SIBO and to parasites.
My goodness.
These are all downstream issues associated with low stomach acid. So,
okay.
So then many of my patients have SIBO, and usually they're going to be worse if they have sugar or carbs, a lot of bloating, and then SIBO in itself is a whole big discussion, but they can be either hydrogen producers, methane producers, or both, and that needs treatment. But often underlying the SIBO, tick-borne infections, particularly Bartonella, which can cause both diarrhea and constipation and abdominal pain, mesenteric adenitis, which can mimic appendicitis, and I've seen abdominal pain and nausea go away treating Babesia. So, these are all issues that can be associated with the tick-borne infections, so that even though they might have SIBO, you got to treat those infections first. Constipation is a big risk factor. Gastroparesis is when their guts are almost paralyzed, and that can be due to neuropathy caused by the tick-borne infections. It can also be worse with the low stomach acid. Can be worse with parasites. We think of parasites as causing diarrhea in their acute phase, but in their chronic phase, they tend to cause constipation. And I think that a whole lot of us have parasites, but they're not a problem if we're otherwise healthy. But then when you add Lyme and tick-borne infections and our immune system goes awry, now these parasites are triggering more inflammation, and not just in the gut, systemic inflammation. It's not unusual that we treat the parasites and their joint pains go away and they have more energy and their headaches are improved, etc. And we see a lot of people with worms. I was amazed that about 3 or more years ago, this lovely woman who was treating for Lyme and Babesia, she came in, she had been about 80% better. She had had some gastrointestinal problems that were mostly better by just going off gluten. And then she told me the story that because of something she read online, she went on Mimosa pudica seed, and Mimosa pudica seed kills worms. And she started passing all these worms, including tapeworms.
It's very strong supplement.
It's very strong. But the amazing thing is she didn't even have many gastrointestinal complaints. Just being off gluten, she was pretty good. And she said after passing all those worms, she just had a ton more energy and felt good. And so I started seeing patients who still had inflammation despite the fact that we thought we were covering all the bases. So I said, take this mimosa pudica seed and see what happens. Over half of them say, oh my God, I can't believe what came out of me. It's really quite amazing. I have a kid, the brother of the kid that I mentioned who was addicted to pickles and olives because he had such a big yeast issue. So he had lots of behavior problems that got much better on the mimosa pudica seed. But what the parents did was they had to treat him every new moon cycle. That, you know, full moon, I should say. Every full moon, they would give him a week of the mimosa pudica seed because that's when he would flare.
Yeah.
So it's so interesting, you know, things that don't make any sense from a Newtonian physics, you know, mainstream medicine standpoint. They're real. I mean, there's a reason that we call people lunatic. It has to do with the lunar cycle. You know,
they say 2 days before the full moon and 2 days after is what I've read in the group. So a week before and a few days after, a week after, I think that sounds very reasonable.
So bottom line, there's a whole host of potential issues with the gastrointestinal tract, and it's usually more than one thing.
Absolutely. And so you would not be a proponent of a recommendation to your patients for Humira. That was offered to me every single year. I get my colonoscopy because I'm a 26-year veteran treating Crohn's disease, right? Ulcers and Crohn's, etc. So I knew it was not for me. And when I first started working with my first Lyme doctor 8.5 years ago, my GI recommended it again. And I told my Lyme doctor, who governed everything in my life at that point, right? I was so sick. He said, oh, the Lyme would have loved that.
And it's true. You know, in my book, I describe a young woman who was diagnosed with Crohn's disease. I think it was Crohn's, not ulcerative colitis, but they're both manifestations of inflammatory bowel disease, which can be quite serious. I mean, people occasionally die from these. And
I almost did.
And she was put on steroids. That made her a whole lot worse. And then I don't remember if it was Humira, she was put on another biological, and again, just flared like crazy.
So as a clinician and researcher, would you like to see our tax dollars fund more research on persistent Lyme? This is super close to my heart, as you know. I'm on fire and getting rid of the term PTLDS in research, so I have to end on that note.
Well, that's a softball, right? I mean, yeah, of course, we need a huge amount more research. It's really a crime how little attention it's getting. Even while there are a plethora of articles, but not where we need it, not where we need
Treatments and diagnostics need funded, number one.
Yeah.
Then maybe vaccines, etc. after all of the cures are found and we're able to pick these people up out of the gutter and ditch and dirt and brush them off and help each other do that. And so that's, again, from the bottom of my toes and heart, thank you so much for your time and dedication and submitting those new publications. That's my last word to you. Thank you so much for telling us about that today, that you're writing and that you're submitting for publications, because as you well know, as we just mentioned, clearly we need way more in the world of knowledge and teaching our new medical students and gaining new researchers to the field of tick-borne illness. And your publications directly, sir, have a great impact, along with Dr. Liegner and some of the others, Dr. Fallon, and some of these great researchers in the past who have led the way. We're so, so grateful. Dr. Rajadas, and there's so many, Kim Lewis, that we want to honor and thank in every single one of our videos that we possibly can squeeze it in. And you're so generous with your time today, so I won't talk anymore because I love talking to you.
Very good.
All right. Well, thanks again.